December is Flu Vaccination Awareness Month. Doctors with University Hospitals say it's a top thing you can do to keep you and your family safe. Now, most people started getting the vaccine in September, but KENS 5's Micah Menace wanted to know, is it too late to roll up your sleeve?
Now's the time to do it if you haven't done it.
Dr. Jason Bowling says no, it's not too late to get the vaccine this flu season. He says it's recommended to get the vaccine as long as there is flu activity until the end of the typical flu season. So when do we see the highest activity during flu season? Dr. Bowling says the COVID pandemic changed that. It used to be highest during the end of December, January, and February.
But over the last couple of years, we've seen earlier trends with flu and RSV, and then we've seen it kind of come back up again later in the flu season as well. So it's been a little more volatile, a little bit more variable.
Dr. Bowling says this flu season, Texas is listed as having high flu activity on the national map.
Locally, we're seeing more cases of flu and RSV pick up over the last couple of weeks.
If you think you don't need the vaccine because you don't often get sick, Dr. Bowling says, think again.
I've seen a lot of people in the hospital and the ICU that have never been sick before, but now they're sick, or they've had flu before and it wasn't that bad.
Dr. Bowling says everyone 6 months of age and older should get the vaccine.
People that are 65 and older are most likely to end up in the hospital, right? But so are people that have underlying medical illnesses.
Underlying illnesses include a wide list of problems that include being pregnant, having diabetes, and being overweight.
Particularly with obesity, they could be at increased risk of respiratory problems and end up in the hospital with flu.
Dr. Bowling says equally important to the flu vaccine is getting a COVID booster. Although COVID infection rates are low, they expect to see an increase. There is also a vaccine for RSV.
For people that are age 60 or older, and so they should talk to their doctors to see if they should get that vaccine to be additionally protected.
Micah Menace, KENS 5.
Dr. Bowling also says insurance companies are required to pay for vaccines because it is preventative health.